my dear teaching faculties, my dear PG, UG students, and ladies and gentlemen, good afternoon to all of you. I think all of you had a good lunch with now the post-lunch session always seems to be very difficult to concentrate, even though you are having good session in this time. I am very happy to appreciate and participate in these wonderful sessions of Homoeo LIGHTEN East Zone Conference 2026. I am happy to introduce our this session speaker, Dr. N.R. He is a highly respected clinician, academician and administrator with 35 years of dedicated service in homeopathy. He is also become a President of Tamil Nadu Homeopathic Medical Council and holded the distinctions of being the first PhD scholar in Tamil Nadu Homeopathic Medical Service. He is also known for his innovative concept of India first mobile homeopathy clinic and delivering care directly to the community. A prolific author, international speaker and media personality, he has actively contributed to public health through large-scale free medical campaign and pandemic service. So now all of you know he is a President of Tamil Nadu Homeopathic Medical Council. After becoming a President of Tamil Nadu Homeopathic Medical Council, he has good work for the improvement of homeopathic system in Tamil Nadu. Really, our Tamil Nadu Homeopathic Medical Council having good president in this session. So now I hand over to session to our speaker. Sir, please, sir.
Thank you. Thank you for everything. So afternoon, you all please sit and listen, because I am going to give a lecture in a very useful topic, day-to-day life for young doctors, budding doctors, and going to complete the internees. It is very useful for your clinical side, because every day we are getting more number of patients is related to respiratory ailments. So I select this topic for this winter season. So this topic is apt and useful for you like people. So our Tamil Nadu Homeopathy Medical Council and West Zone organizes this Homoeo LIGHTEN. We organize this Homoeo LIGHTEN to enrich the knowledge of the students and faculties. So every zone we are conducting this CME program with a very good speaker. So in the morning session also I observed they presented very well. So you please listen this topic. Maybe you may get sleep after food, but I want to involve with you. Now you all have ice creams. Now you all have. Don't forget and followed by arsenic of algae. So, and you had a food, heavy non-veg, if you take more, you may have a heaviness in the stomach. After the heaviness, automatically you may lead to some breathing distress, indigestion, heaviness. Tomorrow you may face this problem. So in that situation, RBS tomorrow, non-veg heavier feel I find very difficult to breathe. It is a kind of gastric asthma. So for that, what you will take? Laxomica. Then Pulsatilla, Laxomica, followed by Pulsatilla, even antibiotic. So like this, we learn the homeopathy from our normal routine life. Respiratory disorders means lengthy topics. Asthma, allergic rhinitis, sinusitis, nasal polyp. Everything comes under respiratory disorder. Then asthma, asthma types, bronchial asthma, cardiac asthma, gastric asthma, status asthmaticus. Bronchial is associated with respiratory disorder with lungs and phlegm involvement. That is the bronchial asthma, characterized by the narrowing of the bronchial tubes. Then cardiac asthma is occurred during the cardiac involvement. Here, the difference between bronchial and cardiac is in bronchial you may find a phlegm expectoration, lung congestion, but in cardiac you may not have that much expectoration. The patient want to breathe during smallest exertion, smallest even talk, even walk, even laugh. And ascending few staircase, finding difficulty. That is a cardiac asthma without much expectoration. But there will be a sort of bluishness may be there and oxygen may be dropped. In that case, we have to be very careful. Gastric asthma is associated with the digestion disorder, indigestion, and reflux, constant reflux, and jerk leads to cough. Contraction of intercostal muscles, shortness of breath gets worse with exercise or activity. Wheezing comes in episodes, may be worse at night or early morning, may go away with smooth, gets better when using drugs that open ears, bronchodilators, gets worse when breathing in cold air, gets worse with exercise, gets worse with hot movement, and usually begins suddenly. These are the symptoms, signs and symptoms of bronchial asthma. The emergency in case of cardiac, to rule out cardiac asthma and COPD. Then homeopathic approach. This is very important for homeopath. When we have the asthmatic, we have a causation for the asthma. So first of all, we have to analyze what is the cause. So the causative factors. Then modalities. Every individual have different modalities in that condition. So you have to observe the modalities. Then position of sleep, peculiar symptoms of cases, then constitution and miasmatic and intercurrent remedies. This is a homeopathic approach. Then causative factors, climate change, damp, cold. So for everyone we have a different medicine. Thunderstorm in summer, asthma in summer also there due to ice cream, and hot and cold sweating suppression like bryonia, and dust allergy, high odor, smell of perfume inhalation, paint odor, and some udvati smell. Like this, people are developing respiratory ailments. For that we have a beautiful medicine. Then sweets, after intake of sweets, you will start throat irritation and develop cough and leads to asthma, wheezing. So lachesis, medorinum, spongia, sanguinaria, these are very good medicines. And food and fruits, banana, grapes, guava, tomato will aggravate sometime. Habit, alcoholic persons develop cough means you have to think of our mephitis, and smoking persons, arsenicum album. Even in Malaysia, in this published in Malaysia Asthmatic Foundation, if we inhale the smoke of mosquito coil, it is equal to 100 cigarettes smoking, bad effects. That much the mosquito coil smell will disturb the health. Then suppression of skin disease also leads to asthma. So medicine is Apis, arsenicum, caladium, Hepa sulph, sorinum and pulsatilla. Then aggravating factors, cold food, inhaling dust, sitting up position, then from talking, change of climate. Then periodicity also. Periodicity. Every week, every fortnight, moon phase aggravation, yearly aggravation. So, being a homeopath, you have to watch everything. Then only we will succeed in these cases. Aggravation from food, amelioration at sea from eating amelioration, graphitis, and from eructation, from stool, pothos, like this. See, the time modalities, it's very important. We are observing time modalities in my clinic, our clinical site. 1 to 2 a.m. aggravation is our arsenicum album. 2 to 4 a.m. is calicarb, 3 to 4 a.m. ammonium carb, 4 a.m. is naxomica, 5 a.m. is sulfur, rumex, natrum sulph, 10 to 11 a.m. natrum mure, and 11 a.m. sulfur, 11 a.m. to 11 p.m. cactus, 12 o'clock arsenicum album, 1 p.m. ferrompos, 12 to 1 p.m. arsenicum album, 3 p.m. apis, 3 p.m. 3 a.m. is thuja, 4 to 8 p.m. lycopodium, hellebora, sabadilla. These are the important time modalities for these ailments, aggravating times. Then during asthmatic condition, patients, some people will sit and bend forward, some people will sit and bend backward. So according to the position, sit and bend backward, we are giving spongia and Hepa sulph. Sit and bend forward is arsenicum album and calicarb. Sitting in inclined position is China, and knee chest position is medorinum. Lying on back with outstretched limbs in sorinum and calibic. Sitting erect is pulsatilla and calicarb. So these are the details you have to collect from the patient side when taking case taking. Then peculiar symptoms. Cough better by eating sweets. Generally we find aggravation from sweets, but better by eating sweets now you have to think of our sulfur. Asthma better by smoke. Generally smoke will aggravate, but better by smoke is giving relief means you have to think of aranya. Asthma better by lying on back, sorinum. Cough better by drinking cold water. Generally cold water will aggravate, but cold water giving relief. That's why it is a peculiar symptom. Causticum and cupramet. Cough better by lying. No cough during sleep. Manganum aceticum, calibic and sepia. That cough from dancing is sepia. Cough, no cough during sleep is manganum aceticum and calibic, because they used to lying on back. Cough better from dancing, sepia, because it is a peculiar symptom. Generally during wheezing, you can't walk, we can't talk, but she is dancing. That is a peculiar symptom. So many cravings are there. I will cut short because it is a lengthy slide. And being a homeopath, we have to assess the case of fully, it's a mental general and physical general to find out the constitution, mental general and physical general. So whether it is a case of ammonium carb or arsenicum album case or calcarea carb case or kali carb case or phosphorus case or pulsatilla case or silicea case, like this, we have to analyze physical general as well as mental general. Then miasmatic approach, through with miasm, whether it is under sora or psychosis or syphilis. Soric means what are the medicines is sulfur, hepasulf, pulsatilla, arsenicum album, sorinum. These are the soric drugs. Then psychosis, natrum sulf, medorinum, tuja, arsenicum album, anticrude, antitot, silicea. Syphilitic group of medicines, mercurius, syphilium, aramet, arsenicum album and acid night. See, the arsenicum album is covered in all miasm. Sora, psychotic as well as syphilitic. Then no source, intercurrent. We are using no source as a intercurrent. Basilinum, medorinum, sorinum, staphylococcinum, tuberculinum, streptococcinum, like this. Then as a constitutional medicine and miasmatic medicines also we are using as an intercurrent remedy. Then for bronchial asthma, these are the common use of medicines. Aconite, arsenic album, calcarea carb, ipecac, helicarb, lachesis, lobelia, naxomica, pulsatilla, sampacus, silicea, spongia, tuja, tuberculum. Then cardiac asthma, these are the important drugs: aspidosperma, cactus, crataceous, digitalis, credelia, lachesis, laurocerosus, naja, spongia, strophanthus. Then gastric asthma, acid sulf, argenum nitricum, carbovage, calicarb, lobelia, naxomica, pulsatilla, ginger beer. So every drugs having its own therapeutics. Being a student, you go and study, because due to time management I cut short this. In your class it is no issue. Chloram, graphitis, ipecac, sanguinaria, sulfur. Yeah. Now you want to compare these medicines. When we will give antidote, when we will give ipecac. Great rattling of mucus in the chest, but only little is expectorated. Tongue is white coated with red and papillae. Here in ipecac, chest seems full of mucus, does not yield coughing. Here the tongue is white coated with red and papillae, but in ipecac the tongue is clean tongue. Here the sleepiness with sweating is a symptom, but here constant nausea with profuse saliva is a main differentiating. Then ailments from vaccination, asthma with skin disease, that you have to think of our ipecac. Then calicarb and ammonium carb, we have to compare. When we will select calicarb and we will go for ammonium carb. Calicarb patient, people with relaxed fiber, inclined to obesity with bag-like swelling between the upper lids and eyebrows. Ammonium carb, stout, fleshy woman with sedentary life must have the smelling bottle with continuously in hand. In calicarb, asthma with bronchitis. In ammonium carb, asthma with pulmonary edema. Calicarb patients always aggravation on lying on right side. And ammonium carb patients better lying on face and abdomen. Calicarb patients wheezing predominant time modality is 2 to 4 a.m. In ammonium carb, the wheezing predominant time is 3 to 4 a.m. This is a time modality. On the basis of time modality, I prescribed many cases. I got cured. The experiences of curing the case. Then arsenicum album, hepasol, asthma from taking cold food, asthma from exposure to dry wind, then anxiety, fear of death with suffocation must sit and bend forward with abducted arms for relief. In HOMOEO, threatened suffocation with the sensation of splinter in fishbone in throat, and patient must bend head backward and sit up, which gives relief temporarily. In Arsenicum album, we notice that restlessness is more, because we know very well Arsenicum album is one of the trio restless remedy, physically as well as mentally. So restlessness will be one of the predominant symptom, and asthma better from warm food, and in HOMOEO, fear of chill exposure always. See the calcarea carp. This is a obese child, 5F constitution. It is mostly suitable for 5F constitution. Fair, fatty, flabby, fear, fatigue. Sweat in head, nose block with polyp, dislike to cover, relieved in open air, milk disagree like egg. This is a picture of calcarea carp. Cilicia is thin, lean child, scrofulous, rachitic constitution. Sweat increase in the palm and sole, especially palm more sweat. Nose block after every cold. Likes to cover or wrap. Aggravation in the open air, trapped air. Dislike milk, like sand. They are used to cover always the head. They dislike even fan air, AC. That is the important symptom on the Cilicia. Tuberculinum. When you give tuberculinum, when you give basilinum. Tuberculinum for thin constitution, basilinum for fatty constitution. Then Loopha operculata, this is practically we are giving for many cases after those who are coming after eating cucumber or some watermelon juices or mullangi, eating of mullangi, and those who are having the symptom of cough, cold, running nose means clinically we are using Loopha operculata 6 potency. In acute condition we are using 4 pills every 2 hours. Within 24 hours they find a relief. That is clinically we are using in many cases. In Solanum lycopersicum prepared from tomato, and aggravation from tomato, that eating tomato some people are telling, and it is very good for eosinophil conditions, patients, eosinophilic. So many rubrics, bending head backward, and frequent use of mother tinctures in clinical side. Aralia racemosa, aspidosperma, Blata orientalis, eucalyptus. Grandilia, Justicia, Lobelia, Senega, Solidigo, ginger beer. So the details of every mother tincture is given. This aspidosperma you should know, because during corona period, those who are coming with less oxygen, even want of air, those who are suffering with less oxygen, this medicine help you a lot for many thousands of cases. I cured 5,000 positive cases of corona during the season. Most of the cases I handle with this. During that period, no oxygen, no bed available. That time, this one is helped a lot. Aspidosperma and carbo-veg. Aspidosperma and carbo-veg did a miraculous heal. From Coimbatore, I had one case, 76. Oxygen was dropped to 76. I put this medicine and carbo-veg also. That patient in 3 days improved 92, 94. He was okay. No bed that time. That time we saved the case with the help of aspidosperma. Blood also one of the good medicine for fatty people. Grandilia, Justicia adulta. This is commonly used in our clinical practice for children and adults, those who are coming with respiratory disorder followed by cold and cough. Lobelia, Senega especially suitable for old age people. Old age people, those who are having lot of congestion, bronchitis, bronchiolitis,
For those it is work. Solidago is with a defective kidney function. Those who are having problem with the defective kidney function with suffocation means you have to think of our Solidago. Ginger beer for gastric asthma with indigestion. Like this. Then 50 clinical tips. If find time I will tell later. Diet and regimen. So many, because respiratory is a vast subject, so that next is rhinitis, rhinitis, sneezing. So these are the homeopathic best medicines in our clinical side. Allium, Sipa, Arsenicum, Alpum, Arsenica, Iodata, Euphrasia, Gelsemium, Lufa, Percolata, Merxal. These are the very good medicines in our clinical side, and Lufa, Percolata, Merxal, Natramur, Naxomica, Phosphorus, Abadilla. Then one by one. Sinusitis. Many people are suffering with the sinusitis. For sinus, allopathically the advice for surgery, but we are curing the cases, so we have to concentrate to learn the sinusitis. We are the people curing this sinus. Sinusitis is a condition consisting of the infection and inflammation of the paranasal sinuses, which may or may not be a result in infection. See, maxillary sinus, frontal sinus, ethmoid sinus, sphenoid sinusitis. Acute sinusitis suddenly appeared with allergic or infection. Types of chronic sinusitis, acute sinusitis. Chronic sinusitis with causes allergy or environmental factors, pollution, constant exposure of pollution. So we have to assess the existing symptom. Sometimes it is associated with the staphylococcal infection. So these are the homeopathic therapeutics for sinusitis. Arsenicum, iodatum, arum, triphyllum, belladonna, bryonia, calcarea carp, calcarea sulf, cinnaboris, hepasulf, hydrastis, halibike, calioidatum, lacasis, lacaninum, stricta, lyco, natramur, pulsata, silicea, spigelia, thuja. Then we are getting repeatedly many cases of nasal polyp, even in infants, children and adults. You should not miss these cases in clinical side. Those who are repeatedly facing these respiratory disorders, if you observe the nose, there will be a finding of nasal polyp. So causes nasal polyp is constant allergy. We have to treat with our homeopathic medicine. For this nasal obstruction, running nose, chronic sinus infection, dull headache, snoring. Snoring is one of the symptoms because of this nasal polyp. Persistent stuffiness, difficulty in breathing, reoccurring of sinus infection, and thick nasal discharge, reduced sense of smell and taste, occasional pain in the face, loss of diminution in sense of smell, mouth breathing. These are the symptoms of nasal polyp. Calcarea carp is number one drug. Lemna minor, kalinite, phosphorus, tucrium, thuja. So these are the clinical sites medicines. In one medicine, Nose block on which side you lies on? Nose block on which side you lies on? அப்போ லெஃப்ட் சைடில் படுத்தா லெஃப்ட் சைடு பிளாக் ஆகும், ரைட் சைடில் படுத்தா ரைட் சைடு பிளாக் ஆகும். வாட் இஸ் ரெமடி? எனிஒன் ரைஸ் யுவர் ஹேண்ட். அடுத்து குயிஸ் வருது, அதுலேயும் கேட்பாங்க. இப்போ யாராவது சொல்கிறீங்களா? டாக்டர் ஜார்ஜ் திலகம் இஸ் ரெடி டு கண்டக்ட் குயிஸ். Nose block on which side she lies on? என்ன மெடிசன்? எனிஒன் ரைஸ்? இல்லை டாக்டர், வேற லாக்கானினமா? Anybody? இல்லை. That medicine is, you have to go through our nerve repertory. Nerve repertory. Tukriyam, Maram, Viram and Rustox. Tukriyam, Maram, Viram and Rustox. So, I want to share some of the cases, interesting few cases. One case, age is 36 years. She is a obese lady, came with a sneezing problem. She used to sneeze every day, 400 sneezing per day. Morning to evening, approximately she sneezes 400 sneezing, she told. Continuously sneezing for years together. Day by day, she developed, because of this sneezing, she developed umbilical hernia. Already she was obese. She developed umbilical hernia. And after that she developed uterine prolapse. Uterus is getting down because of daily sneezing, too much strain. She developed such a very bad condition. And she used to sneeze, nose block and snore. I prescribed on the basis of constitution. She have a nasal polyp also. I prescribed a medicine. She had a craving of sweets and nasal polyp in both sides. Calcarea carb prescribed and ammonium carb followed. After calcarea carb 6 doses followed with ammonium carb, because she is having predominant symptom of sneezing morning on waking, and also she is a very obese lady. After the first prescription, she had more sneezing, so she ran away. She didn't turn to clinic. என்னடா போனமே ஜாஸ்தியாகி போச்சு, ஹோமியோபதி நமக்கு ஒத்துக்கல அப்படின்னு சொல்லிட்டு அக்ரவேட் பண்ணிடுச்சு அப்படின்னு சொல்லிட்டு she didn't return. அதுக்கப்புறம் after 4 months she came back. அங்கே போயிட்டு மாத்திரை சாப்பிட்டு again she came back. Then I started the medicine. I explained to her, initially if you have such a symptom, it is a good sign, you will get a cure, continue like this. After that she continued the treatment. I prescribed the medicine again. The first sitting aggravated, next sitting I prescribed the same medicine, third sitting she started to reduce 50% of sneeze, and medicine 6 doses is reduced to 3 doses, and ammonium carb daily twice for 1 gram pills I prescribed. Then 4th visit, sneezing and nose block nearly 70% better, same medicine repeated. Day by day I start to reduce the dosage. 5th visit, sneezing, nose block reduced 80%, calcarea carb 200, 3 doses, then PL. I didn't give ammonium carb this time. Welcome Dr. Joe. Placebo given. 6th visit, in the 6th visit 400 sneezes reduced to 4 per day. 400 sneezes reduced to 4 per day. Then I stopped medication. She was better. நான் சொன்னேன், இப்போ 4 தானமாக தும்புறேன், போ அதோட தும்பிக்க போ அப்படின்ட்டு. 4 is negligible to her, for her. 400 to 4 because of our homeopathy did a very good job, very good result in that case. She is very thankful to me every day when meeting the clinic. Medicine prescribed on the basis of constitution of the patient. Next, a boy came to me for recurrent cold, on and off for cold, cough. Very often he used to come to me. Due to some various causes, he might have the recurrent cold cough. I prescribed sulfur and arsenicum album and Aralia racemosa, and wheezing also he developed. He used to develop wheezing, cough, cold, wheezing recurrently. I prescribed sulfur, arsenicum album, Aralia, then second visit reduced by 50%. Then patient feels better, had a jangry, gulab jam, jangry type sweets. After developed throat pain followed by cough and yellowish expectoration. That time I prescribed Hepacel every 2 hours in acuteness and arsenicum album 206 doses. Patient feels better, had a feeling of constriction in the throat, and again he used to come with the same symptom. I gave the medicine, he was better, and again coming. That time I observed the boy. That is why I am sharing this case. It is only a clinical observation. When I observe the boy, every time he will not wear the cloth nearing the neck. He used to put the collar like this, the neck separately. The cloth around the neck will be away from the neck. It will not touch the neck. He used to wear the cloth and banyan like this. This is my clinical observation. Clinical observation, he is not wearing shirt, banyan around his neck. He is sensitive to wear cloth around his neck. After I observed the remarkable symptom, I prescribed Lacasis 3 dose that day. After prescription of the Lacasis, he never turned. That is, that problem is completely cured. There is no any recurrence in this case. Previously, on and off he used to come. But after putting this Lacasis on the basis of clinical observation, he was perfectly free from wheezing, cough, cold, throat infection, everything is completely cured. So the Lacasis is very much helpful in this case. Prescribed basic on the clinical observation. So being a physician, we have to observe the case thoroughly. Observation, understanding and application. That is very important for physician. Here only the clinical observation helped. Cannot bear anything tight around the neck. On that basis I prescribe Lacasis 200. Lacasis 200 is a snake, prepared from snake poison, everyone knows. Snake, holding the snake in the neck is the பாம்பு பிடிக்கணும் பார்த்தீங்கன்னா கழுத்தை பிடிச்சி தான் தூக்குவாங்க. ஏன்னா that is a classical point for the holding the snake. அதனால எப்பவுமே இந்த neck around that is very important. We have to observe the case. Lacasis is help in that angle. It is a doctrine of signature. 8 years of nose block. This is also one important case. 8 years of nose block. This is a North Indian boy. His father is a allopathic practitioner in Orissa. He came to me for the nose block, especially during sleep, stuffy nose, and night time when he is sleeping in the bed, he will completely block the nose edge. And என்ன பண்ணுவார்னா ஒரு சைக்கிள் எடுத்துட்டு ஒரு 4-5 தெரு அப்படியே ஓப்பனில் அப்படியே சுற்றிட்டு ரவுண்ட் அடிச்சுட்டு வந்து திரும்ப படுப்பார். அப்போ தான் அந்த நோஸ் பிளாக் ரிலீஃப் ஆகும். ஹி யூஸ் டு டேக் எவ்ரிடே நைட். அந்த நோஸ் பிளாக் டெவலப் ஆன உடனே சைக்கிள் எடுத்துகிட்டு ஒரு 4-5 தெரு சுற்றுவார். அதுக்கப்புறம் ஹி யூஸ் டு கம் ஃபார் தி பெட். ஸோ பீயிங் எ ஹோமியோபத் we observe there will be a open air gives relief. This modality I noticed. Modality, nose block in the night, at the same time he had a strange symptom. He woke up from the sleep, took cycle around 2-3 streets, and another during the nose block, watering eyes, lacrimation. From this modality, nose block and open air is observed. Headache during sleep, mental exertion during reading and writing, generalities and laboratory investigation, sinusitis confirmed through PNS. Lycopodium given 2 hourly, stricta pulmonaria. These are the very good medicine for sinus. Second visit, first visit this prescribed, second visit nose block, headache slightly reduced, not fully. So third visit, no expected improvement. See, in this case, no expected improvement. Medicine selected on the, then I worked the case, reworked the case. Why this case is not improved? Then I repertorize. In Kent repertory, I noticed one point. Always he is stressing the symptom, expressing the symptom, nose block with lacrimation. I worked in the case with the Kent repertory, only one medicine given, borax. But generally we don't think borax is giving result in respiratory disorder. Borax is infant remedy, downward motion giving aggravation for vertigo or mouth ulcer. It is a remedy for like this only, and leukorrhea complaint. These are the leading symptom. But for the respiratory side, no one is thinking for borax. But in the Kent repertory, gave only one medicine, lacrimation with nose obstruction, lacrimation with only one medicine given, borax. So already selected medicine not giving much result. Then why not we try with this? I gave borax 30 only, 6 doses. After 5 days, he called me, doctor, now I have a lot of discharges from the nose. Previously he was a dry nose block. Then only I selected stricta. Now he have a lot of discharge from the nose with yellow color, brown color, black color, all the multicolored Eastman color like this discharge. So he had a discharge like this. So with this medicine, lot of discharge come. After that, he was free from nose block of 8 years. 8 years nose block was cured with single medicine after repertorizing again with our medicine. Seven years asthma, one lady case. She is a 56 years lady, 8 years suffer with the case. She is also came with a problem of asthma and had one peculiar symptom I noticed. During sleep, during asthmatic, daily she used to take 3 to 4 puff. But during asthmatic, she wear the inner garments and thrown out. After that only she will be able to sleep. So in that cases also I worked out and gave lacasis only. Lacasis 1 dose. This 8 years asthma cured with 1 dose of lacasis. Only 1 dose I gave and rest of the medicine is a placebo. She had a lot of phlegm, thick phlegm from the nose. After that, no wheeze at all. Even after some years, I met her, doctor, now I have ice cream. I am facing all climates, but I am not facing any wheezing. 8 years asthma cured with 1 dose of lacasis 200. That is a miracle case in my clinical practice. This is another one case. Due to time, I cut off my cases. One asthmatic cases, gentlemen, treated by me. It is a skin cases, suppressed cases. After 15 years back, he had a case of severe eczema. Putting ointment, lotion, developed gradually respiratory disease and asthmatic. After treating the case, developed asthmatic. Skin old symptom, suppressed symptom came out. Then he scolded me. You gave homeopathic medicine, it is allergic to me. All are telling homeopathic is not giving any side effect, but you gave our medicine, your medicine is gave allergic to me. Then I told him, no, this is a old symptom, suppressed skin disease is coming out. You may have this ailment earlier, skin disease. No. Then I took the book, I showed to him, இப்படிலாம் இருக்குது இதை பாருங்க அப்படின்னு. அப்புறம் ஒய்ஃப் சொல்லிச்சு, 15 வருஷத்துக்கு முன்னாடி உங்களுக்கு ஸ்கின்ல பிரச்சனை வந்தது, நான் லோஷன் தடவி விடுவேன், அப்புறம் அது க்யூர் ஆச்சுது, அதுக்கப்புறம் தான் நீங்கள் இப்படி சஃபர் பண்ணுறீங்க. அதுக்கப்புறம் ஓ ஆமாம் இல்லை அப்படின்னாரு. அப்போ இப்போ ஆஸ்மா க்யூர் ஆகணும்னா எக்ஸ்டர்னலி டோன்ட் புட் எனி திங். இப்போ ஸ்கின்னுக்கு திரும்ப ஆயின்மெண்ட் போட்டால் சப்ரஸ் ஆகும், அகெயின் ஆஸ்மாவிற்கு வரும். ஆனால் அவருக்கு ரெஸ்பிரேட்டரி இது நல்லா பெட்டர் ஆகிருக்கு. ஒன்லி ஸ்கின் ப்ராப்ளம் இஸ் மோர். ஸோ ஹீ வாண்ட் டு, நான் கேட்டேன், உங்களுக்கு ஸ்கின் ப்ராப்ளத்துக்கு வேணும் சப்ரஸ் பண்ணணும்னா ஆயின்மெண்ட் போடுறேன், எழுதி தரேன், ஆனால் ஆஸ்மா வரும் பரவாயில்லையா? நோ அது வேண்டாம், அது இப்போ தான் ரிலீஃபாக இருக்கேன் அப்படின்னாரு. ஃபார் த ஸ்கின் டிசீஸ் சப்ரஷன் ஹோமியோபதி இஸ் டூயிங் ஒண்டர். ஸோ this is the last case, last and final case. 15 years old boy eating sweets. After eating sweets, he used to develop cough. நான் ஹரிபுரியா அந்த ப்ரிஸ்கிரிப்ஷனில் ஒரு நாள் சாங்கினேரியா கொடுக்கும், ஒரு நாள் ஸ்பாஞ்சியா கொடுக்கும், ஒரு நாள் இதை கொடுக்குறோம், சரியாகலை. த மொடாலிட்டிஸ் ஆஃப்டர் ஈட்டிங் ஸ்வீட், மார்னிங் எழுந்த உடனே காஃபிங், ஸ்கூலுக்கு கிளம்புற டைமில் பிரேக்ஃபாஸ்ட் அண்ட் பரையத்தில் எல்லாத்தையும் வாந்தி பண்ணிவிட்டு ஹி யூஸ் டு கோ. அப்போ அவங்க மதர் இரிட்டேட் ஆகி, என்னங்க டெய்லி மெடிசன் கொடுக்குறீங்க, நாட் ஒர்க்கிங், ஏதாவது ஆன்டிபயோட்டிக் ஏதாவது கொடுக்க பாருங்க அப்படி இப்படின்றாங்க. அப்புறம் தான் ஐ சிட் அண்ட் ஒர்க் அவுட் த கேஸ். ஐ செலக்ட் அகெயின் த லாக்கசிஸ் 200. ஏன்னா மார்னிங் ஆன் வேக்கிங் காஃப், டிஸ்சார்ஜ் பை ரிலீவ், ஆஃப்டர் ஈட்டிங் ஸ்வீட்ஸ் அக்ரிவேஷன், எல்லாம் ஒர்க் அவுட் பண்ணி ஒரே மெடிசன் லாக்கசிஸ் ஒரு டோஸ் கொடுத்ததுக்கப்புறம் காஃப் கான். அந்த இரிட்டேட்டிங் காஃப் பை மை ஓன் சன். யார்கிட்டையாவது நான் கொடுத்து இது இன்னைக்கு நீங்கள் சரி பண்ணலன்னா அலோபதி டாக்டர்கிட்ட கூட்டு போயிருன்னு சொல்லி மிரட்டினது என் ஒய்ஃபு டாக்டர் உமா ஜெயக்குமார் இதோ இருக்காங்க. அதனால் இது எங்கள் அதை எதுக்காக சொல்ல வரேன்னா, சம்டைம் தி ஹரிட் பிரிஸ்கிரிப்ஷன் without worked out the case sometimes leads to failure. That also we should not do in our clinical side. We have to do thorough study with the modalities and causation. Clear. Brother, actually I prepared the slide for the students' sake, students and beginners of practice. Otherwise I may select some other topic so that it is little lengthier. Even I cut off many slides. So anyhow, thank you very much for your patient listening in the afternoon.
Thank you, sir. Your words have set a powerful tone and provided a clear direction for our future endeavors. I now request the moderators to share a few words about the session.
Good afternoon to everyone. I first of all thank to organizing committee organize this seminar, and I thank our today's presenter, Dr. NR sir. He is a famous person. Already introduction sir is told. So NR sir is having 35 years of experience. Today sir shared his 35 years of pulmonary disorders experience. So we are waiting for other experience also, sir. Sir, I thank sir. Thank you, sir.
Thank you, sir. I would like to welcome Dr. Narayanappai, MD, Principal, Dr. Hanuman Homeopathy Medical College and Research Center, Rasipuram, to felicitate the speaker and the moderators. Thank you, sir. I now welcome Dr. Porchilvan, Principal RVS HMC, to present the special gifts for the speaker from RVS Group of Institutions and Excel Group of Institutions. To build our confidence in the subject of lung malignancies and homeopathic formulations in vitro and in vivo perspective. Krishnan, to build our confidence in the subject of lung malignancies and homeopathic formulations in vitro and in vivo perspective. I now request the moderator to introduce the speaker.
Hello. Good afternoon, one and all gathered here. I am delighted to introduce Dr. Vinu Krishnan, a clinician, researcher in homeopathic oncology with over 2 decades of specialized experience and currently pursuing his PhD in homeopathic formulation in advanced cancer. He is serving as a Chief Medical Officer under the Department of Homeopathy, Government of Kerala. Dr. Krishnan serves as a honorary member of the Homeopathic Education Board, the National Commission for Homeopathy, Ministry of Ayush, Government of India, and he is also the lifetime member of International Association of Oncology Physician. He is the author of acclaimed book Cancer, a Redemption Through Homeopathy, and played a key role in the conceptualizing and establishing India in first public sector inpatient homeopathic cancer. I am here to welcome Dr. Vinu Krishna for presenting a topic in the name Lung Malignancies and Homeopathic Formulation and In Vitro and In Vivo Perspectives. I wish him all the best. Thank you.
Good afternoon. Respected Chair, respected faculties, my dear colleagues. It's an afternoon time, so apart from what we have heard earlier, let me invoke your attention to a world of malignancy and how homeopathy can offer a help. Is this light so necessary? Okay, fine. So what was our objective is to make a validation, both an in vivo and in vitro. Because as you know, malignancies in general and homeopathic oncology in particular is the need of the hour. Maybe by 2026, India will be having a projection of more than 8 lakhs cancer mortality. And with that, thank you. With that, conventional medicine may not be in a position to accommodate the wholesome need what an oncology field need. So complementary methodology, Ayush perspective is a need of the hour. I presume that this is a gathering of homeopathic students, aspiring scholars and PG graduates, apart from faculties from a cross-sectional part of Tamil Nadu. So let it be a dialect, let it be a conversation regarding the fortunes and prospective aspect of homeopathy. So here we will see a case reports, case series observation, clinical survival, outcome modification, and of course an in vitro validation of how our medicine acts. Students, please keep quiet. Keep silence. This is an epidemiological aspect only. Because of time constraints, I am not spending this much time. With this, we could assume the impact or the gravity of an oncological case. What we did in our center, it's an exclusive cancer center directly by the government of Kerala, Department of Homeopathy. Over a past period of 5 years, we got 476 cases of lung cancers, and we took 114 cases biopsy proven with more than 6 months follow-up. Even though cases may be coming to a registry, not almost all the cases will be following. So we took cases with more than 6 months follow-up and biopsy proven cases, of which non-small cell cancer 105 and small cell lung cancer 9. Homeopathic methodology was used as an add-on or adjuvant therapy in 53 cases, and monotherapy means standalone. In advanced case of lung cancer, where conventional medicine is unable to compensate the need of the patient, especially when the patient is unfit for radiation or chemotherapy, 52 cases were selected as monotherapy also. So this was the medicine chart we gave. Kali carbonicum and arsenicum iodatum was the most frequently prescribed medicines. You cannot even imagine the impact of lung cancers and its tumor burden to the patient, because we took stage 3B and stage 4 lung cancers. Stage 3B and stage 4 means the primary lesion has progressed from the ipsilateral side to the contralateral side. Also, wide lymph nodes may be involved, and disseminated metastasis either to liver, to bone, or to brain may be happened. This is a statistical analysis of a mean and median survival time. In monotherapy, 95% confidence interval is a statistical observation. It is not the context to explain the meaning of confidence interval. This was the analysis we got. In add-on cases, we got. Add-on means homeopathic methodology was used along with the chemotherapy or targeted therapy, as it is a case. Every time when we say about survival, because what is the purpose of using homeopathy as a therapy? Homeopathy could improve the overall survival rate, or the expected survival will be always OS should be more than ES. OS means overall survival. The expected survival is the usual survival for an established lung cancer patient. So in our case, whenever we used homeopathic medicines as an add-on therapy, the overall survival could cross genuinely the expected survival. Whenever we speak of survival, Kaplan-Meier is the standardized analytic curve. So in standalone means in homeopathy alone, we got a survival curve like this, and when homeopathy was given as an add-on therapy or an adjunctive therapy, the curve flowed like this. So this was the case series observation what we got. Non-small cell lung cancer, 8 cases. Actually it is 10 case template. 9 cases non-small cell and 1 case of small cell lung cancer. Here you can see, here it was add-on after surgery and radiation. Standalone means homeopathy alone, standalone, after chemotherapy, after radiation, standalone, after chemo, after radiation. Left upper lobe lesion, left right middle lobe lesion. The medicines, OS means the survival rate, that is in calculated usually in months. See the first case, 98 months we got, 142. As I told you, these are the observations done on a factual registry over the period of 5 years. Every time a before and PET scan was taken to evaluate, rather to validate imageologically. We cannot go for biopsy after treatment. It's not at all possible and not at all a plausible idea. The patient may not be in a condition to go for a biopsy. But the confirmatory test, what we can do is a PET scan. So after PET scan, every time the primary lesion showed a reduction, especially there was no metastasis. That is the idea. Because we all know that in a malignant case, within 6 months or 12 months or 18 months, as is the case, metastasis may come to either to liver, to bone, to lung, other lung, or to brain. So reduction of metastasis is also, please, students, if you want to talk, please go back. Please don't disturb. So our idea is to control the metastasis also. Overall, by controlling a cytoreduction and metastasis, what we get? A good quality of life. And never say that our primary aim is good quality of life, because quality of life is a subjective validation. Our validation should be objective. Our metric should be objective, because it should be understandable to the scientific community that the lesion has regressed with the help of complementary medicine. The lesion has not progressed and the lesion has not disturbed. That means overall a disease stabilization. What is the purpose of using homeopathic medicine as an add-on in oncology case means primarily and essentially it is causing a disease stabilization, a reduction of symptoms, control of the lesion, control of the metastasis, and overall it will cause an augmented survival rate or an enhanced survival rate with a good quality of life. So this was the analysis what we got. The overall survival outcome can be plotted like this. That's only a graphical presentation of PET scan evaluation. How we can assess. Every time when we have one case success, then try to collect more cases. Then only our data will get a compact idea. Also, our data will be objectively validated to the world of science. Every time our system is being rebuked or refuted as placebo or it doesn't act, then how can we make it things true? That means we have to translate the data into black and white. That means into the dialect of medicine or dialect of science. So what are the key observations we got? Overall survival ranged from 17 to 204. Even in advanced non-small cell lung cancer, we got a good survival. As I told you, advanced non-small cell lung cancer means it's a death passport. Earlier, there was only chemotherapy or radiation, but stage 3B and stage 4 can't go for chemo or radiation because the lesion will be large. It has disseminated into the other parts of the body. It has micrometastasized into the lymphatic channels of the body. So it's not at all a game for a stage 3B or stage 4 lung cancer to get into the conventional medicine. So how they are coping, that is the chance of immunotherapy. That's why immunotherapy emerged as a true modality. In immunotherapy or targeted therapy, they have to identify specific mutations. In lung cancer, EGFR is the most prominent mutation. Almost 40% of the cases carry a mutation positive of epidermal growth factor receptor or EGFR. Other mutations are ALK, ALK, ROS, MPNET, BRCA, other mutations will be there. Overall, these mutations will compromise only a 40% of total lung cancer. The other 60% are with unidentified mutation. So that is the area, that is the entry point of homeopathy, because stage 4 lung cancer with unidentified mutation, no chance for conventional medicine. Only a palliative chemotherapy. Then why can't we go for homeopathy? That is the option. Our sky is our limit. 60% of the cases, stage 4 lung cancer, can be tried with homeopathic medicine with marvelous results. We can touch the life of a malignancy patient. So the disease stability, as I told you, disease stabilization. Don't think that even students of colleges may think that give a dose of medicine, all malignancy will wend off. No, nothing. Pathology, deeper pathology, gravitational pathology can't be changed in a day. But the intensity, the frequency, the burden, the tumor burden can be reduced so that the disease will be stabilized and the patient, the individual can go further. That is the idea. So this is a case report. Non-small cell lung cancer where homeopathy was used and we got a follow-up period of 12 years. 12 years. And see, the patient presented with a single symptom. It's cough with hemoptysis. A simple symptom. See, 2006 and 7, the mediastinal mass 5.1 into 4.2, it gradually progressed. And the patient reported to us in 2013, and the lesion was in right middle lobe and right lower lobe. On CT scan, it was seen like this. You can see the scan reports. 2014, the impression, soft tissue density mass lesion, lateral segment of middle lobe. This was the timeline. Whenever we present a case, it is better to use or coinage terms like this. We should have a timeline of presentation. A patient may be coming to your OP and if you are presenting a case before 10 years, it should be better translatable into a timeline. Fix a timeline because 6 months, 12 months observation is itself carry a value. So this was the thing, calcare carb, kali carb, as and when symptoms. 0/3 means LM potency. I can give you an advice that if you are passionate enough to treat oncology as a specialty, try to use 50 millismol potency. Even more than centismol, it could act because advantage of 50 millismol potency is it can be repeated easily. Apart from the idea of centismol or a decimal, it can be frequently repeated, it can be changed without any drug interaction. That's why in advanced aggressive pathology, we usually advocate the use of LM potencies. So this was the timeline going, and CT scan when no increase in size. What we got a scan in 2025 was heterogeneously, see only a residual primary, no metastasis. And that is the beauty of homeopathy. Without metastasis, the patient is going further. even though the primary tumor was not at all cured, the patient is leading a peaceful, coherent, organized life. Another case, this is a second primary. Usually, nowadays, double primary and triple primary is not a singular thing. This was a case of CA lung occurred in a previous case of CA breast, for which she did an MRM, modified radical mastectomy, and for that she took chemoradiation. But again, a primary lesion occurred in left lower lobe, adenocarcinoma. In this dialogue presentation, I avoided the histopathological classification non-small cell adenocarcinoma because of time constraints. They did a lobectomy and the mutation was negative. So this is the timeline again. Natrum sulfur was prescribed. Natrum sulfur, LM potency. In 2022, a new CT scan was done with no new lesions. So this is possible with homeopathy. Left lung moderately differential adenocarcinoma, lung primary. This is the before scan. Low grade lesion, lower lobe of left lung. Lower lobe of left lung is the specific anatomical affirmative place of natrum sulfuricum. This is the after scan. See, no lesion there. Only a subpleural bronchiectatic change only. Lesion has disappeared. So this is possible with our medicine. Another case, a right middle lobe lesion with a nodal metastasis. Again, this case underwent chemotherapy. The case was, our mode was adjuvant. Adjuvant means after a definitive treatment. Timeline was like this. We started with calcarea iodide. Here you can see ALK positive. It's a mutation positive case. For ALK mutation, conventional medicine uses osimertinib, which is very costly and it should be continued for a longer period of time. Most of the patients may not be economically affordable with that. So these are the mutation, and we prescribe medurinum as intercurrent and again arsenicum iodide in LM potency. So this was the before scan. You could see the lesion. Afterwards, reduced in size compared to the lesion has reduced in size. Patient is continuing our treatment. So case 4, it's a case of a right lower lobe lesion with nodal metastasis. A right lower lobe abutting pleura, and for that they did a right lower lobectomy. So timeline started with kali carbonicum, changed to 0/306. The lesion was primary malignancy. No evidence of no metastasis. That is the idea. So after a clinical in vivo validation, I was curious enough to delineate, rather to decipher why or how our medicine also act. Because modern medicine is capable of explaining to the scientific world that how gefitinib act, how osimertinib act, either through apoptotic induction or through cell cycle blockage or through a tumor suppressor pathway. But we homeopaths are unable to say how our medicine. Usually it is being questionable that the modus operandi, how can we explain the modus operandi of homeopathic medicine? So this is my PhD topic also. I was very curious enough to identify what may be the cell cycle checkpoint, how a medicine could act favorably. Because consider two groups. One group, stage 4 lung cancer, taking conventional medicine. Second group taking our medicine. Both groups could get the same survival rate or even more than. Then how come this medicine may be acting on the same line of conventional medicine. Let us check it further. So, mechanistic studies was planned, and this is only a short idea of a mechanism. Actually, it's a elaborate topic, just giving a just idea. So, what was the purpose? To bridge the wisdom of homeopathy with the molecular dialect of oncology, just to know how a micro dose can cause a macrobiological response. Our medicines, minimum dose, ultra dilutions, usually refutable to the world of pharmacology, then how these medicines are capable of making a true macro pharmacological response. MTT assay was done, and this assay is the gateway assay. While MTT assay could say what is happening, other downstream assays could say that why this is happening. These are cellular cell line studies. Postgraduate students may be knowing it better. In your college also, you should initiate studies on cell lines with homeopathic medicine. Then it will be much more concrete enough to say to the scientific world how our medicine could act favorably. So MTT assay was the gateway assay. It could assess the primary cytotoxic potential. IC50 value, inhibitory concentration was calculating. And next, this was the comparative arsenicum iodatum in multiple potency. 6C, 12C, 30 and 200 was selected with a biological control and with an alcohol control. Since our medicine is being dispensed in alcohol, an alcohol control should be there, and this is the composite graph. So concentration versus cell viability was plotted, and what we got is a dose dependent reaction. This is the effect on cell cycle, whether arsenicum iodatum is capable of making any cell cycle perturbation. Perturbation means any change, any significant change. In the world of oncological diaspora, we could be able to say where the medicine is going to act, either in the S phase, synthesis phase, G1 phase, G0 phase, or the G2 phase, or the mitotic phase. Because modern medicine is capable of saying that this medicine acts on the G2 phase or the mitotic phase. So the cell cycle proliferation is cut off. Bevacizumab acts on the tumor angiogenesis. So it is capable of cutting the supply of blood. So that's why we get a reduction of tumor. Unfortunately, we can't say where and when and how our medicine acts. This is a humble, a preliminary attempt to collect an information or to get an idea where this is acting. So this S phase, you can see the 6C, 32%, 12C, 30C, 200C. It's a complex thing. That means arsenicum iodatum in various potencies is capable of making a change at the G2 phase, mitotic phase, or synthesis. And 12C made a good change. So this is the composite graph. Cell cycle distribution is showing vehicle treated cells was made as a control. Comparison with potencies reveals reduced proliferation and increased apoptosis. What we should expect, apoptosis should be the correct thing, because apoptosis means regulated cell death, while necrosis is pathological cell death. We expect an apoptotic cell. So our medicines at higher potencies was capable of making apoptosis. Annexin 5 staining was, so we got a result in MTT, then it should be corroborated with apoptotic studies. Annexin 5 staining was done, and see, 12C made a remarkable apoptotic response. 12C and 30. So next escalated study is protein expression, mRNA studies. So I went further with mRNA expression. In mRNA expression, this axis is being studied, P53, P21 and P27. P53 is the guardian genome, which is causing the entire harmonious, coherent, organized movement of a cell, which is explained by Master Hahnemann in the aphorism 9. the spiritual dynamics, the vital force that animates the material body, rules with unbounded sway. This is the explanation of P53. See the extra vision of the master. He could be able to say, even while discovering guardian genome, that there is a symphony of cell movement. So whether our medicine is capable of making a change, that was the idea. So this was the expression. The pro-apoptotic Bax P53 and caspase-3 was up-regulated and the BCL2 was down-regulated. Remember my students, BCL2 is the up-down regulator gene, while Bax, BCL, caspase-3, P53 and caspase-3 are the up-regulatory genes. These are complex studies. So this is the comparative graph. You could see the P53 is going up-regulation. The color shows P21. So relative expression and potency was plotted and a graph was, result was like this. So what we got? Homeopathic ultra-dilution studies evoked a hormetic response. A hormetic response means low dose stimulates, intermediate doses sustains, and while higher potency stabilizes. So whenever we do a protein expression, we should get an inverted umbrella, that is the U-shaped curve. This experiment revealed out an U-shaped curve that showed homeopathic medicine arsenicum iodatum induces a hormetic biphasic pattern. Again, to confirm the protein expression, phosphorylation of AKT should be done. So Western blot was done with arsenicum iodatum and the result was like this. Western blot results signaling pathways. This signaling pathway is regulating cell cycle, proliferation and cell multiplication. So the medicine, if it is capable of making a change, that means our medicine are also acting in line with that. To confirm, the last assay was caspase 9 and 7. Caspase 3 we did in annexin 5 staining, while caspase 9 and 7 was estimated with indirect ELISA. These are complex things. Arsenicum iodatum again in multiple potency was used and the result was like this. Caspase 9 is the initiator and caspase 7 is the executioner. So we got the intrinsic mitochondrial pathway is also being modified. I told you, we should expect an apoptotic regulatory cell death. Then only we could say that the tumor cells will die of their own. So summing up, this was the integrative validation. We did an MTT assay, we got a dose-dependent inhibition. We did annexin staining, we got apoptotic pathway inhibition. In cell cycle blockage, caspase 7, mitochondrial intrinsic activation. Western blot got down regulation showing that signal surviving was okay. And RT-PCR or mRNA expression showed that our medicines validates molecular pathway validation. So how come? Maybe because of this arsenicum iodatum or any of our medicine was capable of handling the patient. So this is my center. It's an exclusive cancer center. I can invite all students there, faculties from Dr. Hanuman College, Dr. Chandran sir, and his friends are there. They had visited our center. Actually, it was a 10-bedded center. Now it has progressed to a 50-bedded inpatient exclusively cancer center where I am working. And this is my book. It's available. Overall, the past 20 decades, what I got clinically, and it's an idea, it's volume 1. If anyone is passionate enough to pursue oncology as a profession, they could make it. And thanks for the time. Thanks for the organizing committee.
Thank you. Powerful roadmap for the challenges and opportunities ahead.
This was the most informative, evidence-based documentary presentation by the most eminent research scholar from Kerala. I hope many of them have enjoyed and you will get inspiration that how much you can go. Thank you.
Homeopathic Medical College, Kanyakumari, to felicitate the speaker and the moderators. Thank you, sir. I now welcome Dr. Porchilvan, Principal RVS HMC, to present the special gifts for the speaker from RVS Group of Institutions, an Excel Group of Institutions. இவரு